Hi, my name's Shani Collins, and I'm a student at Pacific College of Health and Science in the Public Health Education and Promotion Bachelor's Degree program. This is a presentation for the Biology for Public Health Professionals class, in which I will briefly discuss Enterococcus, where it comes from, how many cases of it there are per year in the United States, and some public health programs that are addressing some of the challenges presented by the spread of Enterococcus. I chose this as a topic because I suffered from recurrent UTIs ever since I was a baby and spent much of my life after ureter surgery at the age of 3 dependent on antibiotics to fight the constantly recurring infections. Learning as much as possible about integrative health practices to get off of antibiotics and heal really saved my life. I've had UTIs from many bacteria, including Enterococcus, and it puts my mind at ease to spend time learning as much as I can about these bacteria. So, Enterococcus, what is it? Enterococcus is the singular form for the word, and enterococci is the plural form of the word. Etymonline.com explains the etymology of enterococci as in, or in, entero, or intestine, and cocci, or spherical-shaped bacteria. Putting these linguistic pieces together, we can see that the name itself refers to a spherical-shaped bacteria in the intestine. This makes sense as enterococci are explained by floridahealth.gov as, quote, enteric bacteria that normally inhabit the intestinal tract of humans and animals, end quote. Merriam-Webster.com defines Enterococcus as, quote, any of a genus Enterococcus of gram-positive bacteria that resemble streptococci and were formerly classified with them, end quote. According to floridahealth.gov, the, quote, presence of enteric bacteria can be an indication of fecal pollution, which may come from stormwater runoff, pets and wildlife, and human sewage. If they are in high concentrations in recreational waters and are ingested while swimming or enter the skin through a cut or sore, they may cause human disease, infections, or rashes, end quote. So, Enterococcus is a gram-positive bacterium, but what does gram-positive mean exactly? According to the CDC, gram-positive bacteria are, quote, a group of germs characterized by having thick cell walls that are increasingly resistant to many available antibiotics. They often find new ways to develop resistance and can sometimes share these abilities with other bacteria, increasing the spread of resistance. Examples of gram-positive bacteria include streptococci, staphylococci, and enterococci, end quote. Additionally, the CDC describes gram-negative bacteria as, quote, a group of germs characterized by having relatively thin cell walls that are increasingly resistant to many available antibiotics. They say these germs often find new ways to develop resistance and can sometimes share these abilities with other bacteria, increasing the spread of resistance. Examples of gram-negative bacteria include Acinetobacter species, P. aeruginosa, and E. coli. The CDC reports that Enterococcus is a type of bacteria that, quote, can cause serious infections for patients in healthcare settings, including bloodstream, surgical site, and urinary tract infections, end quote. They go on to mention that the United States reported 54,500 cases of vancomycin-resistant Enterococcus, or VRE, in 2019, and that 5,400 of those patients died. It started out for me with a UTI. I took the antibiotics full term, as I was told, and they helped. But I had no idea while I was a child and into the years of becoming a young adult that the consistent dependence on antibiotics was actually causing a lot of harm to my body and contributing to quicker and stronger UTIs that would become harder and harder to treat as antibiotic after antibiotic would stop working. When the doctors had me on an antibiotic a day as a preventive measure, and I could see an unspoken concern in their eye after the antibiotics started waning in effectiveness, one after the other. I asked what would happen when all of the antibiotics stopped working. The doctor was silent for a moment and then told me in a somewhat shocked or confused manner that they wouldn't be able to clear the infection without the antibiotics, and if that happened, I would die from a kidney infection, pneumonia, or a ruptured kidney, just like thousands of others who were in a similar situation. According to the CDC, quote, VRE is increasingly resistant to additional antibiotics, raising concern that the remaining drugs to treat VRE may become less effective, end quote. It's refreshing to see some public health campaigns and programs that address this issue. In Tallahassee, Florida, there's a public health program called Florida Healthy Beaches Program, which began by, quote, monitoring for Enterococci bacteria under a grant-funded pilot program, end quote. This was implemented in 1998. The program has changed in many ways since its inception, but it continues to sample beach water in order to monitor for Enterococci bacteria. This is an excellent example of public health measures being taken in an appropriate manner to test the water and maintain efforts to inform the public about these beach water tests and why they're important to public health. I would love to find creative ways to help as well. Thank you for watching.